There is no doubt that COVID-19 has changed the world as we knew it. It has cost many lives, many jobs, and affected us all in a way we could never have imagined 6 months ago. I fully recognise the weight of responsibility on the shoulders of those making huge decisions that affect the lives of millions, balancing the health and indeed survival of more vulnerable members of the population against the economic and social consequences for all. My concern is that their response has not moderated or followed the science quickly enough, especially as the COVID infection rate falls. They do not use dental-specific research and rely too heavily on guidance applicable to a hospital and transfer this to a primary dental care setting. I fully accept that at the beginning of the pandemic, little was known about SARS-CoV-2. It was classed as a high-consequence infectious disease, although from 19th of March, this classification was removed by PHE and others. My concern is that PHE guidance does not reflect this lower classification of disease, that the level of PPE required, the fit testing of masks, and the follow time has consequences for both dentists and patients, which are significant and cannot be ignored, even when weighed against the obvious consequences of COVID infection. Bupa tell me that in none of the 12 countries in which they operate do they have such onerous restrictions, but there is no requirement to fit test masks, and either no fallow period or a very short cleaning time between appointments. PHE does, of course, have form. You remember date stamping autoclave packages of instruments from 2009 to 2013. After 21 days, instruments were mysteriously contaminated again, despite the profession repeatedly challenging the validity of this guidance. The current situation seems very similar. Patients are being denied access to care. Dentist financial viability is being threatened. Such a restrictive practice needs evidence, not a, there might be an issue, so we'll introduce a policy. Those trying to present evidence or mitigating factors face a talk to the hand response. So it is time to follow the science and learn from the rest of the world. There does not appear to be evidence that anything more than baseline PPE is required for dentistry, both AGP and non-AGP. We have protected ourselves and our patients through years of seasonal flu, HIV, hepatitis, mad cow disease, swine flu, you name it. We've kept ourselves and our patients safe. The advice from PHE is excessive. The rest of the world has returned to a workable normality, but we remain hampered by guidance which makes practice deeply unpleasant, restrictive, and detrimental to patient care. Patient dental health is being severely affected due to procedures which have no evidence to support their requirement. Please support this motion. Thank you.
Okay, well, thank you for that, Ian. And do we have anybody that wants to respond to this? I do. I have Russell Gidney here from Wales. Russell.
I'm going to be unpopular and speak against the motion, I think, because most people are looking to support this within the chat. And I fully agree with the kind of idea that this raises. But unfortunately, when you're dealing with something that's risen so quickly where no evidence exists, then it's not possible to have evidence before you impose. Certainly some review of what's imposed when evidence comes to light, and that then being published is a good idea, but the actual first pandemic has to be handled without the evidence being there, so I don't feel this motion can go through.
Okay, thank you for that. We have Stephen Schimberg next. Are you speaking for or against the motion, Stephen?
Well, I'm actually asking for an amendment to the motion. Is that possible?
Okay, right. Now, if we are making amendments to motions, this falls under section 10 of the standing orders. And we have to ask, what is the amendment that you would like to make?
I'd like to make an amendment to the wording. I'm very much for the motion, but I would like to add, instead of evidence, I would like to add the word specific and verified scientific evidence.
Okay, now if we are going to amend this motion, we need a seconder to that. So is there a seconder to Stephen's request for an amendment? Now, actually, if you can put it in the chat, then that will probably be the way to go ahead with this.
And Leah, you've also got a couple of people have got their hands up, so.
Okay.
You could ask a second just to unmute to speak if they wanted to, I think.
Could we ask the seconder if they want to speak? So I can't amend this motion without somebody seconding it.
Martin
Otherwise, we'll go
Longbottom
ahead
has
and.
put in that he'll second it later in the chat.
Oh, right. Okay. So we have a seconder. So what I would like you to do in that case is to, we'll ask Stephen to write the specific words down, pass it through the chat function to Alex Chenich. And what we'll do is we'll amend the vote, and then we'll go back to this. We'll let people speak again, and then we'll have the vote on that. So this is going to be adjourned until we can get that in place. And in the meantime, is it possible to go to motion 18?
Thank you.
Oh, I know. Actually, I tell you what, I should actually ask the mover of the motion, in fact, if they're happy with that as well. So it's Ian. Are you happy for that amendment?
My unmute button. Yeah, I'm just looking at the chat. I think Ian Mill's approach is perhaps better wording, Stephen, even than yours. It's going for the same sort of idea, but is a little less clunky and maybe so bold as to suggest I prefer Ian's amendment.
Okay, shall we put Stephen, are you happy with Ian's amendment?
That's fine.
Okay, so we have an amendment. We'll get that organised and go back to motion 17. Oh,
sorry, Leah, do we have a seconder for the other amendment, just to be pedantic?
Oh, right, okay, yes, let's follow the rules. Seconder for the second amendment.
I'll second it if that's all right.
Is that okay? Right, okay.
Yeah.
So, right, parking 17 for the minute. We are going to go back to the motion session, and I'm sharing the load with Stuart Allen. So I'm going to leave you in his capable hands again. We're going back to motion 17, I believe. And so over to you, Stuart. Stuart, I think there were some people that still wanted to speak to this motion. Are we? Russell has his hand up.
Oh, right. It's not showing on mine at all.
Oh.
Oh, there's a...
Russell, do you want to put your hand down?
Oh, yes, it's just come up. Russell, do you want to speak?
Yeah, please. I spoke against this motion, which I will withdraw, but unfortunately not necessarily in the spirit that people would like me to. I feel that now we've got evidence-based or risk-based. I think the response to this motion will just be, well, that's what we did. We took a risk-based approach. So I don't object to this motion, but I don't feel it necessarily actually carries any weight to it now.
Right, and I think Ian Gordon wants to come back, as he's entitled to. Ian, are you able to speak?
Sorry. Yeah, I wanted the motion to be more robust, as Russell has alluded to, and but I'm happy to support this, and I say I'd go with the amendment. I think it does need to be robust. We have had one other motion that was quite robust, and if you're looking for evidence, Russell, we can look to the rest of the world in Europe, and if anybody could point out to me anywhere in the world where dental practices are being seen as a hub for COVID infection, where there's super spreaders that are emanating from dental practices as a risk. If anyone can show me where a reduced fallow time has caused problems elsewhere in the world, and explain to me why Bupa can operate in 12 countries, as I said in my presentation, without the need for the fit testing, masks and fallow time, well, I'm more than happy to listen to them and say I'm wrong. But there's a vast amount of evidence from literally hundreds of thousands of patients getting treatment in a post-COVID world and the rest of the world, yet we are ignoring it and looking for evidence that doesn't exist.
Thank you. Right, no further hands up. If anybody wishes to speak, raise your hand now, or forever hold your peace. I think, Binal, we can now put the vote in the old-fashioned way up.
That's the old-fashioned way. Let's do that.
Please remember to click submit once you've voted.
They're coming through. nearly there. Okay. There you go, Stuart.
Well, that's quite a high proportion for 85%, 5% voting against and 10% abstaining. So that's clearly carried. Thank you.